Mua. So today we're going diarrhea and dehydration. So first of all, for diarrhea, we always need to ask the patient whether he's having fever, vomiting, and how long is the diarrhea, how many times he or she was having diarrhea for a day, and is it watery diarrhea or bloody diarrhea? What's the color of the skin? And for children, you always need to ask about how's the feeding, and is he or she drinking milk? And how about the urine output? Is it increasing or decreasing? So for diarrhea, you always need to remember to evaluate the degree of dehydration. So for severe dehydration, you always need to ask whether there are any sunken eyes and very slow skin pitch, 1 to 2 seconds, and the patient will be unable to drink, feed, or eat, and the patient will lose lethargic. But sometimes there are just some degrees of dehydration. So other than the sunken eyes, the skin pitch is low, but it's less than 2 seconds. And the patient can still drink firstly and drinks eagerly. And instead of looking lethargic, the patient looks irritable and restless. So to understand the treatment for diarrhea, you need to understand the pathology, the etiology that causes the diarrhea. So let's focus on watery diarrhea. So as you can see, on the watery diarrhea, there are many viruses. It's very difficult to be detected, and for virus, antibiotic is not useful. And there are also some bacteria that can cause watery diarrhea, which produce toxin. So in this case, antibiotic is also not useful. And for watery diarrhea, there's also protozoa. So in the stool, you can get cyst, flagellates. And last of all, helmets like the crown beast can also cause watery diarrhea. So in the stool, you will detect how about bloody diarrhea, which is also called dysentery? So as you can see, no virus will cause dysentery. It's only caused by bacteria. So in this case, you need antibiotic for the treatment. And protozoa can also cause watery diarrhea. So yes, too, you can find cysts and ciliates. And also, of course, helmets like schistosomiasis can also cause diarrhea. So in the stool, you will find the eggs of schistosomiasis. But what are the common etiology of diarrhea? So in 2012, there's a study called Global Average Multicenter Study, which is called GEM study. So this study was conducted in Africa, in Kenya, Mozambique, and South Asia, and Bangladesh, India, Pakistan. So let's focus on watery diarrhea first, which is the blue column. As you can see, the most common cause of watery diarrhea is rotavirus and Shigella enterotoxin, E. coli, and then Cryptosporidium. So in this we will find history of Cryptosporidium. So adenovirus. But how about dysentery? Well, now let's focus on the red column. As you can see, the most common cause of dysentery is Shigella or enteroinvasive E. coli. And then adenovirus and adenovirus can also cause dysentery. So antibiotic is the key treatment in dysentery. So let's focus on the treatment of acute diarrhea. The first of all is the dehydration. So if the patient is not in shock and with severe dehydration, we just mentioned about the before, severe dehydration, which is diarrhea, 2 or sometimes very slow escapage, lethargy, and unable to drink. So in children with severe dehydration but not in shock, if the patient is not having malnutrition, we can give Rigoslec or Mucilin for the step 1 treatment. And after that, you can also consider oral rehydration solution. So if you don't have ORS, you can always use salt and sugar to mix oral rehydration solution. However, the patient is in malnutrition with resuscitation must be very careful as the patient is very easily to develop pulmonary edema. So in this case, we use Rizoma rehydration solution for malnutrition given orally or through a tube. So as you can see, the standard beneficial oil has high sodium, but Rizoma has low sodium, which is more suitable for malnutrition. If you don't have Rizoma packet sachet, you can also use ORS sachet and mix it with more water and more sugar to become Rizoma. So in malnutrition children, we use Rizoma, but if the patient is having malnutrition, you can give oral hydration solution. And if the children is already having some dehydration, so the patient is restless, irritable, and still springs eagerly, you can only use an oral rehydration solution and Rizoma instead of fluid infusion. Because in malnutrition, it's very easy to develop edema. So the second treatment is zinc. So for children younger than 6 months old, we give 10 milligrams per day for 10 to 14 days. So for patients who is older than 6 months, we give 20 milligrams. And it is advised to feed continuously, and we only give antibiotic in dirty diarrhea. So the antibiotic for body diarrhea, ideally you can use oral antibiotic 3 to 5 days, to which most local strains of Shigella are sensitive. So we can give ciprofloxacin as first line treatment, or consider second line treatment with ceftriaxone. And if the flu shows the X for schistosoma, it can be consequential 40 milligrams per kilogram divided into 2 doses, 4 to 6 hours apart. And if the diarrhea persists for more than 14 days, we need to suspect different type of etiology like amoebiasis, so in the stool you will find cyst, or Gardnerella lumpia, so in the stool you will find flagellates. So in these 2 cases, you can give metronidazole for 5 days for the treatment. And remember to test for HIV, because diarrhea for more than 1 month is considered WHO stage 3 AIDS, acquired immunodeficiency syndrome. So the first take-home message is remember to ask questions in diarrhea and remember to evaluate the degree of dehydration. And then diarrhea, different diarrhea has different etiology. Remember to check for the stool and only give antibiotic in dysentery. And for the dehydration, remember to give zinc, antibiotic only if need diarrhea. And consequential for schizophrenia, remember to check stool in persistent diarrhea, and remember to test for RBS, HIV. Thank you.